Everyone, I'm Dr. Ellie, and I'm here with my podcast, I Heal Kids. And if you do not know me, I am a holistic pediatrician in Asheville, North Carolina. So if you are in or around Asheville, North Carolina, and you need a holistic pediatrician that specializes in integrative functional medicine and optimizing your child's genetics in the container of mind, body, and spirit, then reach out to me. Again, my practice is Middle Path Integrated Pediatrics. I also, just so you know, see people ages 2 to 102 for functional medicine. So if you need any of that, definitely reach out as well. And if you don't know what that is, check out my other pods because I have a lot on that too. I am super excited today. I'm actually talking to all y'all parents and caregivers because it is September 4th at the time of this recording. And we are in the thick of just the crud already. So, your kiddo has probably headed off to daycare, preschool, kindergarten, elementary, whatever. And you're just like bracing yourself for the parade of sniffles and coughs and tummy stuff and I don't know, all kinds of just yucky junk, strep throat, things like that, which I'm already starting to see. And if you're a first time parent, I want to reassure you it will be okay. Kids do get sick, and it's part of how their immune system learns. So, while we're going to learn all about how to boost immunity, we're not aiming for perfect immunity because that wouldn't really be possible at all unless like your kid lived in a bubble or something, which is not too realistic and also like not really socially and emotionally very healthy. So, what we're looking for is just basically immune resilience and helping your child's immune system respond and recover smoothly. So, I just want to take a couple of minutes to talk about like the different perspectives. So, conventional pediatrics, and again, nothing super wrong with this approach, just different and maybe not as complete as I would like. What do they say about this topic? So most kids get sick about 6 to 8 colds a year, according to the American Academy of Pediatrics, especially in school years. I've definitely seen stats higher than that, up to like 11 times a year for new daycare kids and things like that. And that's considered normal. The approach is basically going to be quote unquote supportive care, which is basically fluids, rest, and monitoring for something more serious. This would be all in the context of like your kid's got some snot and cough and yucky sore throat and things like that. But we're not talking about some severe bacterial illness that's requiring hospitalization, further support, urgent care, anything like that. But in those normal circumstances with the sniffles and stuff like that, it's kind of rest, fluids, and monitoring for signs, right, of something worse. They'll urge you, and I urge you to do this as well because we're not ignoring conventional pediatrics. We're blending it together, right? We're integrating it with holistic care. So you want to seek a doctor if you are seeing any of the following. So if your kiddo has like a fever higher than 104, which by the way, if you're a first time parent, fevers of 104 are not uncalled for with kiddos with viral infections, especially. I tend to see it in that kind of 2-year-old range, like 15 months, that kind of range, sort of toddlery sort of time, sometimes even a little bit younger, but definitely still like, we want to get evaluated and see why they have a fever that high and just get it checked out. Obviously, if your kiddo is having trouble breathing, if it's very acute and they really cannot breathe, please call 911 or go to the ER. Okay. That said, if you're just like, they seem to be breathing a little faster than normal. Maybe you're like, do they have a wheeze? Like, what is that sound they're making? Something like that. Please go seek a doctor's appointment if you feel like it's something that can wait a little bit longer, or if you're like, holy moly, they're making like a really high pitched squeal. I don't know where that is coming from. It's freaking me out. I don't think they can breathe. Please go to urgent care or seek immediate medical attention. Dehydration. So I know this one is like super hard because you're like, I don't know if my kid is dehydrated. Basically, if you have a kid in diapers and they're not urinating, if they don't have a good, I always say 2 to 3 good wet diapers, okay, in 24 hours, that's a sign that they can be getting dehydrated. If inside their mouth is dry, a lot of times kids will have kind of like drier skin on their lips. But for sure, if inside where you would normally expect to be drool and things like that, that is dry, that's a sign you need to go and like check in about what's going on. If they're crying and no tears are coming out, like please go figure out what's going on. Sometimes it's just like, they're like super upset and like they can't get the tear out. But if it's in the like context of they're sick and they're vomiting and they're not able to drink and all of that, and they're having no tears. I mean, that's something you want to definitely get checked out. If they're vomiting so much they can't keep down fluids. If you pinch their skin, this is another good one to try. If you pinch their skin, like on their cheek or their finger, it should turn more pale and then it should turn back to the normal skin tone real fast. If it does not do that in like 1,000 seconds, like 1,000, 1,000, 1,000, like someone needs to check your kid out because that could be dehydration. And dehydration is a big problem in kids because they're so little. So if they can't keep the fluids down, they may need IV fluids and we want to get them into an urgent setting. Okay, lethargy, everyone. This is just my observation, y'all, from being a pediatrician for so long. We all think that, how do I want to say this? It is easy to use the word lethargy in a way that's not the medical word lethargy. Okay, so when your child is a little more tired than usual because they're sick from a cold or something, that is not necessarily lethargy. Like when we're talking about lethargy in medicine, this means that your child is so sick they cannot wake up. You can't rouse them. They will not play with you. They will not eat. They will not drink. They're just laying there. You're like, what is going on? At no point are they interacting normally with you. That is a huge red flag. Please go seek urgent care. If you're not sure, call your pediatrician. Because you hate to go to the ER and have it be like, oh no, they were just like a little bit tired from their cold. Then you're like, okay, now how much did I pay that copay? Just crazy. Okay, I'm going to cough. We'll edit that out. All right, lifestyle stuff. Okay, so what can we do in addition to all this conventional advice? Okay, so how can we integrate in all of the different things in holistic medicine to boost your child's immunity? Number one, we're going to start with basics because y'all, it is super easy. And I do this all the time to be like, okay, I have my vitamin C. I am ready for winter, but I also am not sleeping because I'm working on my business and I haven't exercised in 3 weeks. And my nutrition's been down the drain also because I forgot to do my meal planning. And then I'm like, well, why am I still sick? And it's because I'm not focusing on the foundation of immunity. And so we do need to start with the foundation and then we can layer on top of that other immune boosters. But just having immune boosters without having the foundation is really not going to I mean, it helps, but it's not like you're really not going to get where you want to go. Okay. All right. So, number one, fresh air and movement. I promise you, if you get your kiddos just outside and running, even if it's just 20 minutes of play, tag, or running around in the creek, or scavenger hunts where you're hiding fun little things for them to find. Anything like that, taking them to the playground, making sure your older child or teen is having that time on their bike or scooter, or, if they're involved in an organized sport, all of that is really good and it helps lower infection risk. Okay. And that is because exercise actually improves your circulation and it supports your immune cells. So if you're not doing it, you're really not getting what you need. And exercise is kind of one of those things where we just kind of poo-poo it and we're like, whatever, it's just exercise. But honestly, the number of times I've heard from both conventional and holistic doctors, like if we could package exercise in a pill and give it to everyone, we would totally do that because everyone would be so much healthier, having less heart disease, less lung disease, less immune problems, all of the things. And, because we're human, it gets a little out of whack and we don't always do it, but it's really important, you guys. So make sure your kids are moving. Number two, sleep. This is truly the magic medicine. Okay. Kids, teens, even adults, those of us who are not getting enough sleep, we are going to get sick. Okay. And that's because we don't have enough time to restore. Our bodies don't have enough time to heal. We can't process our emotions well. We're just not getting what we need. So, just for reference, like a preschooler would need like 10 to 13 hours of sleep. And then, like a teenager, closer to 8 hours. Sometimes they need more, especially if they're pushing really hard for exams, they're going through a growth spurt, or they're having a lot of physical activity. But it's a good amount of sleep, you guys, anywhere from preschool age where you may need up to 13 hours, and those teenagers may even need 10. So if we're not sleeping, we're going to get sick. So prioritize that. Okay, enough said on sleep. We can always talk more about sleep hygiene, how to get your kids to sleep, all of that. That is definitely another episode for another day. Okay, hydration. I need a drink right now. Okay, I don't know why, you guys. It's like super dry for some reason, but it was raining this morning, so I don't really understand that. Someone who's a meteorologist, let me know. Okay, so hydration. Water, 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 and water. And as much as adults, okay, as much as I would love to inform you that you could drink as much coffee as you wanted and that that was water, it is not. There's water in there, but it's not doing what water is doing. Okay. So we need to really find ways to encourage kids and ourselves to drink water. Now, sometimes we have to sort of tempt kids a little bit by kind of sneaky things like crushing up a little bit of strawberry, like real whole strawberries, you guys, not like gross, yucky food dye syrups and things like that. Okay. And putting it in their water bottle. Sometimes cucumber is really nice in the summer. Sometimes you can do herbal teas. I love like a good chamomile tea to help people sleep. Things that have vitamin C would be like, good rose hip or hibiscus tea is also good. And then for kids who are over 12 months old, bone broth is great. Under 12 months is fine. You just have to make sure no vinegar, no salt. So really just water and bones. And you also have to be careful that they're 6 months and up because we don't want to be feeding a lot of water to young infants. And also 6 months and up, you just want to check like how much they can have with your pediatrician because it depends on their age. So you don't want to overdo. And we also don't want to be replacing formula or breast milk with things like bone broth and water in young infants. So just or tea. So really young children, as I'm talking this through, infants under 6 months, really we want to stick with breast milk and with formula for hydration. 6 months to 12 months, they can have a little bit of things like bone broth and tea, but you just have to be careful that there's no honey in it because they could get Clostridium infection. And also you just have to be careful with the volume because we don't want to replace their nutrition, which is breast milk and formula for the most part, and then some solids with other fluids. Okay, so check in with your doctor about that. And then 12 months and up, we can definitely start doing some more different types of fun fluids. Okay, stuff that is not hydration. Any soda pop is not hydration. Now, I know y'all, there are times where you're like, the only thing my kid will drink is a little bit of Sprite or something. I'm not going to be here to judge on that. I'm just saying, like, okay, if they won't drink anything, obviously you need them to drink something. But in the ideal situation, that is not the best thing. Why? Because it's super high in sugar. It can worsen diarrhea. It has high fructose corn syrup that affects the liver. All kinds of yuckies and soda. Caffeine can be a problem. Then they can't sleep right. They're peeing out all of their liquids because it's a diuretic. So we don't want any of that. So when I say tea, y'all, I don't mean like caffeinated. I mean like herbal tea. What else on hydration do I want to say? I feel like we covered most of it. Make sure your kids are drinking water for so many reasons, for detox, for pooping, for illness, for immune. I mean, we have to put water in our bodies. Nutrition. This is another one. I know that, well, I feel like I talk about this till like the cows come home. Isn't that an expression? I think so. Anyway, sugar is not really a food group. I'm trying to think if that's true. Maybe there's like some argument that you could make towards it being a food group. I guess if you're thinking about complex carbohydrates, how they break down into sugar. Anyway, maybe that's the wrong way to state things. But processed foods that are high in sugar, especially when your kid is sick, is going to dampen immune cell activity. It just doesn't help. So again, I know y'all are saying, well, the only thing my kid will eat right now is ice cream and popsicles. Of course, like if you literally cannot get another fluid into them, I am here to support you. We will work through it and we will work on their microbiome on the back end of that. That said, do your darndest to please try to get some like normal types of whole, organic, non-processed foods into your kids. So like what would be good things? So things that have zinc, if your child is not shellfish allergic, oysters are really good for zinc. Things that are iron rich, like if you're a carnivore or you're an omnivore, you could do meats. If you are wanting to boost vitamin D, things like salmon, like fatty fish are really good. All of the dark leafy greens, all of the antioxidant vegetables. So you want all the color. So citrus for vitamin C, and then antioxidants, there's all kinds of different things, and then things that detox too. So if you're basically getting color, cruciferous vegetables, dark leafy greens, kale, those are like the best. So do your darndest to figure out a way, whether it's a smoothie, whether it's mixing some into a broth, whether it's blending it up in a little spaghetti sauce, just trying to get something healthy in your baby, in your child. So again, this is like for older kids that can eat, obviously, not your newborn infant. Try to get them the right types of foods to the extent possible that you can. And try to avoid sugar because it does dampen immune cell activity, and that will for sure contribute to illness and all kinds of yucky. Okay, the last one in the foundations, stress and rhythms. A lot of people really do not think about like relaxation techniques in kids. And this is something I talk a lot about in my practice, and I would like to talk about it more here. I think maybe I'll try and do a podcast on that sometime. But oftentimes I kind of get blank stares. And I think it's because you don't think about your child needing necessarily a relaxation technique or something to help them chill out or to reduce stress in their body. And I guess it's because a lot of the things they do seem like not stressful to us. Like, it's not that stressful going to school, right? It's not that stressful starting a new sport, right? It's not that stressful worrying about your friend group, right? But if you actually sit and think about it, like the first times that we ever did any of those things, that's super scary. Like going to new school, going to kindergarten for the first time, terrifying. Meeting new friends, terrifying. Being afraid that people don't like you, super not good. I mean, there's all kinds of things that are really stressful for kids. Potty training can be really stressful for some kids, even especially kids that are not neurotypical. So neurodivergent kids can really struggle with stress with all of that sensory input that they're processing, all of the different ways that they're trying to function in a world that doesn't work for them. So those can be other things that can cause stress. So we need to have some kind of way to improve vagal tone. What is vagal tone? That's to do with the vagus nerve, which runs basically brain to belly, and it helps us sort of like have a relaxed way of living or being. It's involved in nutrition and digestion, rest, restore activities, parasympathetics, all of that. So we're trying to increase what we call vagal tone. So how do we do that? Well, so for infants, I think one of the best ways is to co-regulate. So how do we co-regulate? That is by making sure like we ourselves as parents are regulated. So this is really hard to do, especially when you're sleep deprived, when your kids are having the 4-month sleep regression, when your infant is newly born, when they're teething. There's a lot of phases that make it really a challenge to stay regulated. So even if there are things you can do for yourself, such as make sure you're taking a shower, make sure you are getting healthy foods in your body, even if you have to order a food box, which I know is a super privileged thing to say, but if it is in your budget, please do. If it's not in your budget, just trying to find a way to get to the grocery store and buy some normal food or having a friend do it for you. Trying to do breathing. So the 4-7-8 breath, I love that for kids and adults. You breathe in for 4 seconds, you hold your breath for 7, you exhale for 8. Do that for 1 to 2 minutes, especially when your baby is crying or your toddler is screaming. That honestly is my number one piece of advice, is do that breath before you respond in any way to a child who is extremely activated. Unless it's an emergency, like they're choking, heaven forbid, then obviously respond immediately. Okay. So we want to co-regulate. We want to breathe ourselves. Then we want to attend to our infant, breathe with them, meditate with them. Obviously, they're not going to be sitting cross-legged next to you when they're 2 months old. You're going to hold them, breastfeed, bottle feed, put on a meditation, see if you can get some co-regulation, because your energy is going to reflect their energy and their energy is going to reflect your energy. So we want to learn how to be less stressed together, go for walks, get some sun, try to see a friend once in a while, all of those good things, get support. Older kids, what can we do? All of that, plus now our children can do things themselves, such as bubble blowing, which I super love, especially for young children. They can either use like a fluid that they're drinking, such as like if you do oat milk at home, they could use a straw and blow bubbles into that oat milk. And that will help them do what? It helps them give them a breathing exercise. We can also teach them as they are playing outdoors in nature, which is another stress reliever, to blow bubbles using non-toxic bubble fluid that you can make or purchase. And they can blow bubbles, and that helps them regulate. Belly breathing. This is another amazing one. So you can teach kids to learn to feel their bellies move in and out as they breathe so that they can learn to slow that breathing down, bring that sympathetic system down. Older children can learn more fancy breathing techniques like the box breath. Some of y'all may have heard of that, where you breathe around, according to a circle or a square. And then the 4-7-8 breath in like older people. The one type of breath you want to try and steer clear from is any kind of activating breath. So breathing really hard, or if you notice like a breath exercise is taking your child into hyperventilation or worsening something, then back off. I also do not recommend trying to do this with a child who is extremely escalated already. These are prevention techniques. So there is nothing worse. I don't know if this has ever happened to you, where you're like having a meltdown yourself. Maybe you're crying. Maybe something really just stressful has happened. You can't breathe. And someone is like, just take a breath. And you're like, I literally cannot in this moment. Like, it's not going to be very effective. So that is not the very first approach I would take with a kid who's escalated. We can talk about that later. But in that case, maybe try just noticing their state of mind. Okay, so like, I see that you're very upset, and then you can go from there. But that's a different discussion for a different day. Okay, other things we can do for stress and rhythm: meditation, kid yoga, lots of fun yoga on YouTube that's free for kids. Progressive muscle relaxation, that's a great one for sleep. So this is where we like tense up different parts of our bodies and help it rest and relax, ready for bed. Coloring is great. I love a color journal for kids. If you can ask a kid to just color about how their day went or how they're feeling or anything like that, especially if they're not verbal yet enough to write, that can be really helpful to get out their feelings so that you can have a conversation with them about your day. Try going on a walk with them. Try doing something that is physical, that you're standing side by side, so it doesn't feel confrontational or oppositional or like you're having a deep discussion, because that can be like off-putting and stressful for some teens and preteens. Okay. Obviously, for stress, exercise is another one that you can do. So many techniques: aromatherapy, acupuncture, acupressure, so many things. But the idea is pick one or two things that your child or you can do regularly throughout the day to maintain lower stress. So I do 4-7-8 breathing, and I always tell my patients I do it when I do charting at home. So if y'all don't know, oftentimes doctors, after they're done seeing patients, have a lot of work to do on their computers where they have to input information about what they talked about with their patients and all of that. And that is called charting. It is not my favorite thing in the world. My favorite thing in the world is seeing my patients not spending time charting on the computer. So I like to do a lot of breathing then and then at red lights, because I just tend to get a little edgy around a red light, whether or not I'm running late, by the way. So that is a good time for me to do breathing. And so I do that very consistently. And then I do either a meditation or sleep music before bed, and sleep routines are a whole other combo that we really need to have. Okay, so I am realizing we're going to need to do a whole aromatherapy episode, but I think that's enough for this episode. So final thoughts, you guys. Okay, so conventional pediatrics, kind of wait and see, some supportive care, and the warning signs, which we still use in holistic medicine. Obviously, if there's an emergency, we want to seek emergency care. But in integrative medicine, we take a different approach, right? We're supporting those foundational things. We're supporting stress reduction. We're supporting nutrition. We're supporting mind body, if that's your thing. We're supporting rest, all of that stuff. And then we're adding on other things on top of that, like homeopathy, like botanicals, like essential oils, when appropriate. And it's all safe and supportive. Why not do it? It's great. Your child's immune system will be boosted, antioxidants, all the good stuff. I highly recommend it. It does not mean that your child will never, ever, ever get sick, but it does mean that they may recover more smoothly, more quickly, with fewer complications and all of that. So just remember, focus on those basics: sleep, hydration, our circadian rhythm, stress reduction. Make sure you're doing those optional supports like vitamin D, probiotics, herbs, if that feels right for you, the appropriate age for your child. And know when to call your pediatrician, which if you missed that, go back and listen because it's really important. And then you'll find more details all about it in this week's blog, this week's newsletter. and I'll be sharing like lunchbox tips and all of that. So if you are not signed up to my newsletter, definitely get it because it's actually, I don't know, I think it's really good, but I might be tooting my own horn because I make it. But I actually think it's really helpful. I write them all myself. I don't have like a team writing my newsletter. So I really do try to give you things that are good values. So sign up for that. It's on my website, middlepathintegratedpediatrics.com. I'll try to put together an immune support shopping list if I haven't already in this week's newsletter. And also, you guys do not forget my Nourish with Confidence course, which goes deeper into infant nutrition and supplements ages 0 to 12 months. There's like the 0 to 6 month one, the 6 month to 12 month one, or you can get both. And if you're a member of the family at Middle Path Integrated Peds, you get it for free. So if you want to become a member and get that as well, I would love to see you. Sign up for a meet and greet today on my website. And thanks for tuning in. So just remember, y'all who don't come to my practice and cannot reach out to me, the podcast is for education only. Really do not substitute this for personalized medical advice. You just need to know when to contact your child's health care provider, get the correct doses, find a holistic pediatrician, and all of that. And I hope this was helpful. I'm wishing you well. And come find me at Middle Path Integrative Pediatrics. Again, if you don't know me, I'm Dr. Ellie, and I'm a holistic pediatrician, and I see kids 0 to 21 for holistic pediatrics and kids 2 years to 102 for functional medicine. All right, wishing you well, and look out for next week's episode, which I think is going to be part 2 of this because we'll have to split it into 2. If not, maybe I'm going to do fall allergies, but we'll see. All right, bye guys, wishing you well.